Ellis, thank you so much for joining us on the Buckingham Blueprint podcast, The Diary of an EHO. It's a real pleasure to have you here. Can you start by sharing a little bit about your backstory in terms of what got you into environmental health?
Great. Yeah, no, thanks, Ketan. Thanks for inviting me here. Delighted to be here and be part of your podcast series. So I was first inspired to be an environmental health practitioner, mainly by two of my mum's friends.
Oh, wow.
One was called John, and John was a head of environmental health and trading standards in West London. I grew up in West London, and he'd come to our house, talk to my mum, and he, my mum and dad were friends with his mum and dad, and as you grow older, you take an interest in what people do, and I learned about weights and measures and food safety and seizures, and it all sounded very exciting. Both my parents were scientists; they're both lab technicians.
Oh,
So
wow.
my mum worked for the NHS. So
I've started my career as a scientist. I
really,
digress, but
yeah.
yeah.
Well, yeah, no. So, and the other mum's friend was a guy called Joe, and she was good friends with someone called Jenny, and Joe was Jenny's partner, and so Jenny used to deliver Meals on Wheels. Again, this philanthropic social enterprise working for a local authority, and again another West London EHO. He worked for I think it was Richmond upon Thames, and in conversations about what they did, I learnt about noise pollution and food safety and housing and health and safety, and I think I was attracted to the fact that maybe not I could change the world,
You could
but
change your immediate world.
yes, I could do I could do something that would be a positive outcome. I could make the world better. I could try
You
and
can make a
yes,
difference.
yes,
And that's what environmental health professionals do.
yes,
Make a positive difference.
yes, yeah. So I'd
The
say that was
unsung
my
heroes.
yes, absolutely. I'd say that was my influences as growing up as a
Amazing.
teenager, and it was around the time I was taking my kind of subject choices. So my
At A level.
kind of GCSEs.
Okay, so, oh, oh.
So both my parents, as they were scientists, lab technicians, so I chose to do all three sciences, and it was around that time. I think 14. I was 14, and I decided I wanted to be like John, like Joe. I wanted to be an environmental health officer.
Amazing. Amazing. So, in terms of your early career, what would you say would be the most standout moments for you?
Okay. Well, I was very lucky by living in London and having a great opportunity for different employers. So my first job was for the London Borough of Harrow, which we're very close to today, so I feel slightly at home. And my second job was for Westminster City Council.
Very different.
Yeah, absolutely. At the time, they were like the Manchester United of local authorities. They had all the money. It was a time when Manchester United were a good team, or successful team. Not that I'm a fan of them, but they were a very highly regarded local authority. It was a seat of government, and I worked in a 24-hour noise team. So we had a shift of 16 different officers. I worked with the equivalent of like 15 dads, old wise men, who are my age now, and they handed over lots of advice. But we were going to parties, turning off car alarms, silencing noisy air plant, dealing with concerts, anything from a building site, smoke, dust, vibration, any alarm, any kind of noise, buskers. So we drove around these cars, these Vauxhall Astra cars, and we could park anywhere in the West End. And it was a 24-hour system, so I'd work shifts, and they
We
were
work very close with Westminster
yes,
still on
yeah,
the shift, so they
yeah,
have the shift still,
yes.
and it's still a very very vibrant borough.
Yeah, and it was a heavily invested service, so they had lots of money, and they had pre-carbon printed notices. They had a list of justice of peace and
So
magistrates you could
you'd
phone
walk
up.
up in pairs, would
Yeah,
you?
we'd always work in pairs. Well, we were supposed to
And
have
did
done.
you use a that machine or sound level meter?
Well, the Westminster City Council also had a technical officer team that they would go out and do the noise monitoring. So they measured
Okay.
background noise levels, particularly for noisy air plant. So we'd be in Westminster, Victoria 1 minute, and then in Kensal Green or kind of Maida Vale the next minute, dealing with like noisy parties. But the greatest privilege was one working in the seat of government in Westminster, working all hours and entering and going into buildings that you would never normally go inside. So, for example, theatres in Covent Garden, museums in kind
Amazing.
of the west part of Westminster. So it was. I learnt a lot. I learnt how to resolve conflict, elicit conflict, serve notices, take enforcement action. They were quite an enforcement-minded local authority,
Hmm.
and I met lots of different people, and we were on the cutting edge of, I suppose, noise enforcement. And I was young. I had a Zone 1 and 2 travel card. At the time was a massive perk. And I was 23 and I was earning relatively a good salary compared to what my parents had earned at the end of the career. So it was cutting edge, but there were some lowlights I could perhaps share. Two valuable lessons I made. We dealt with a concert, Midland 97. So an entrepreneur hired the old Battersea Power Station, and they brought in an acoustic consultant. And my lesson I learned there was I believed everything this noise consultant said. So I learned what I learned to not take what people said at face value. And another lesson I learned was later on at Islington.
Could you share a bit more about that?
Yeah, absolutely. Yeah, so it was a big concert, and the noise, as people know, noise bounces, it canyons, it reflects, it cascades. The noise literally bounced off the Thames into, you may not be familiar with the Dolphin Square estate where all the MPs used to live, and Churchill Gardens estate. And we'd worked with the MPs, we'd worked with this community, and I had received these assurances from this acoustic consultant. They'd roll out the bass, they'd put these acoustic cloths on, they'd monitor the noise, and they'd regulate it by time. And they weren't genuine. They just wanted to get the concert going. And it's quite a funny story in that the last act was Prodigy and Paul Weller. And we eventually had to serve a notice on them saying take out the low frequency bass noise, and they did.
So the concert still went ahead.
The concert went ahead. It was slightly tinny, not so bassy. And on the last night, Paul Weller and the Prodigy came on and goaded the council and goaded the crowd. And I'll paraphrase for politeness of the podcast, but more or less said, the council have told us to be quiet. The crowd were like, boo! And then they just said, insert expletive to the council. We're not going to take notice. And the last night, they rolled out the bass again. They turned it up, and as a practitioner, I had to go back to the office, and I was embarrassed.
But you were led to believe what was told by a professional, an acoustics professional, right?
Yes. But I learned a very valuable lesson, which is not to take what so-called experts say at face value. So that was...
and the second one, you said?
I worked at Islington Council for most of my career. And we got involved in a planning application for a large residential accommodation. And I was under some pressure to support the council in resisting or coming up with legitimate reasons why this development should go ahead. So I measured the rooms, and I was encouraged to find fault, to audit, and I did find fault, and I discovered that the rooms were too small for our standards, and the council were very keen to amplify this and appeal. And to cut a very long story short, it turned out that I'd mismeasured the rooms, and they weren't as small as perhaps I thought. So again, that was quite embarrassing.
Wow.
And we lost the appeal. So the lesson I learned there, Katan, was always check your work.
That's very, that's I rate that, being honest about that, and and that applies to anything really, doesn't it?
Absolutely.
Always check your work.
And the other thing I could have done was ask someone else to check my work. I was under some pressure, and I suppose that was another lesson to learn, to try and resist pressure.
So roughly what year was this?
So it's about 1999, 2001. And the really annoying thing is there were other departments for this local authority that had made mistakes. I won't name those departments. But the team I worked in, the environmental health team, were kind of...
They bore the brunt of it.
We bore the brunt because we admitted we made a mistake.
But you were working collaboratively with other teams.
We were, yeah. There were other two departments who also made mistakes. But
I can figure which departments they are.
But they didn't get any flack. They didn't get... and costs had to be paid. I think it cost the council £10,000. But to the credit to my employer, I wasn't victimised. I wasn't blamed. Someone spoke to me and said, make sure your work gets checked in the future. But they were very kind to me. That was a
valuable lesson.
A very valuable lesson, to check my work and get other people to check my work.
So that was 25 years ago, right?
Yes.
The landscape of environmental health has changed immensely. What do you think are the major changes that you've witnessed?
In the profession?
Yeah.
So as a profession, I'll perhaps be critical first before I'm positive. As a profession, we certainly have less influence, I would say. I'd say we have less agency. We have a much smaller workforce. As a profession, I feel we're less relevant, we're less meaningful.
Do you think that's changed post-COVID? That when you say less meaningful, I think I maybe agree with you, but I think there's been a sort of almost a revival of appreciation for the sector.
Yeah, I think with certainly our public health credentials, I think have been highlighted. But as a profession with a shrinking workforce and an aging workforce, we don't necessarily have a active national recruitment strategy. So I think environmental health has changed. I think we've, got to understand that, since 2008, there's been, under the Osborne Cameron government, there's been significant, austerity. Councils. I remember at Islington Council, we had to save 50 million, and then we saved 50 million, and then the next thing is that we've got to save 80 million. So local authorities have less money, and as a profession, a vocation, we are invested in less. So we are a prevention service, and we are invested in far less. So I'd say it's changed. There's less of us, and I would say we're less influential. We don't command the ear of government. We don't command the ear of MPs, and I think we can turn that around, trying to be positive now, by developing partnerships. So here I am, face to face with you in your offices, developing a personal relationship, getting to know each other, collaborating as you do with Buckingham Futures and other partners. And I think one thing environmental health practitioners can do to make themselves more influential, more meaningful, more relevant is to get out into the real world and start developing personal relationships by having events, by meeting people face to face, and to try and move away from this
Nothing can beat that.
remote world.
We spoke off camera earlier that the virtual world is where the next generation of EH professionals will hang out.
Yes.
But at the same time, nothing quite beats meeting someone, shaking hands, and seeing what they do, and talk to someone who does that role, what it entails. Because at the moment, there's quite a negative view of the profession because we work with schools and colleges. So we work with people before, and this is why I wanted to ask you how, because you're actually an anomaly in terms of people that want to do environmental health. A lot of people fall into it, and they go back, as you'll probably see from UWE, to do the masters, but they look at environmental health as a career to go into at a later stage, whereas you've actually planned it as a career, and there's very few people that have come across in 27 years like that.
Yeah, well, in the 90s, when I went to university, there were 12 institutions taking on 18-year-olds, and churning out EHPs, EHOs, and now there's far less institutions doing the degree, and far less people.
Well, I've noticed that myself. 27 years ago, when I first started recruiting in environmental health, when thankfully you invited us to UWE to speak to students, but we've done that with a number of universities, and each year the student numbers has dwindled. Before, lecture theatres used to be packed out. So much so that people would be sitting on the stairs and stuff when we did careers events, and then we'd have breakout sessions for mock interviews, CV workshops. And each year the number of students has dropped. And then more recently I've seen the increase, but the increase is quite often overseas students who will complete their studies and return to their countries of origin. So we won't be adding to the EH workforce over here.
No, I mean, obviously contributing to the workforce somewhere. Just going back to the public health, the post-COVID, one thing I think the profession has changed or got better at is kind of going beyond regulation. So, partnerships and prevention. I think there's more partnerships that environmental health practitioners, and it has to be. It can't just all be about regulation. But so I think, we used to have a thriving workforce that were good at regulating, and we had investment in there. But we've certainly seen some changes in the profession and in the people going into the profession, as in there's less people going into the profession.
So being frontline in that, being a senior lecturer, what do you think that we can do to attract? I mean, I've got my own views on this, but what do you think we could do to attract the next generation of environmental health professionals?
Yeah, okay. So we need to, this has been said for a long time, we need to get better at telling people what we do. So one goal or one measure of that is for primary school children and primary school teachers to know what an environmental health practitioner is. So most primary school children and primary school teachers know what a doctor, a nurse, a fireman, or a policeman is.
Yeah, but people, they go in.
Yes.
And speak to them, so they plant that seed very early on.
Right, yeah. So we can get into schools. The other thing is there is a misconception. So there's a research paper. If anyone's a CIH member, if you go into the research journals, the very first research journal you'll come up to, I think it's 2001, is some work that some people did to find out what are the barriers about people coming to prevention. So this research, 25 years old. You could read it tomorrow and think it was written
Relevant.
last week. It's still relevant. And one of the things it says is that the perception for some people is that following over sensationalized programs like Life of Crime and the sensationalization of some hoarding
Like
cases,
rogue landlords,
rogue landlords,
pest control claims.
yeah,
and
Mr.
things like-
Mr. Trebus kind of stories and kind of not very unethical sensationalization and humanization of these cases of vulnerable people, that people think it's about pest control, it's about Life of Crime, it's about pests, and it's about referees cleaning and working in a mortuary. Now all that's possible and all that's available. So I think get the message out there to primary school children, but also clarify what the vision is. What is it that environmental health practitioners do? So I've got some definitions. We assess, identify, and manage risk. We do this through prevention. We do this through partnerships. We
Advice.
Advice, engagement. We do it through partnerships. We work across the determinants of health. We reduce accidents and injuries. We ensure psychological and physiological methods requirements are met. We do all these things, but we need to get the message out there to public health leaders, NHS leaders, businesses, that this is what we do. And if you invest in us as a profession, we save society money, we save the NHS money, it leads to growth. So, post-COVID, we learned that you can grow the economy and people's health. So change perception and get into primary school. So there's a lot of work with outreach that goes to secondary schools. Some literature suggests that some people have already made their choices by then.
Before they start their GCSEs even.
So get the message out there to primary schools and get the message out there about what we do.
Interesting.
What about your? You said you've got some ideas
Well,
of why people aren't getting into it. How would you reduce?
I mean, you've hit the nail on the head in terms of the general perception. So one thing I do ask secondary school students, we don't work with primary schools.
Yes.
I mean, I have 2 primary school age children and 2 secondary age children, but generally when we speak to students, what do you know about environmental health? The general sort of consensus is that it's dealing with hoarding, pest control.
Yes.
Well, not even particularly pests, rats.
Yes.
They think that that EH professionals are rat catchers.
Yes.
And so there's just a lack of awareness. But also when we do events careers events, and we have a stand there, as to lots of other organisations, environmental health are never represented, sadly.
Yes.
You have the police force there, the RAF, and all other professions, most other professions are there. So young people are able to speak to them and get an idea what it's like. And even there's some interactive stuff that they can do, and environmental health is so interesting that you could bring some samples of it and stuff with you and really make it interesting. And that's where you'd gauge interest. Where some of the events we do, footfall's over 2,000, for example, big events, right, of young students, sixth formers and year 12s and 13s.
Yes.
And environmental health, I often find Buckingham Futures is the sole representation of environmental health.
You become an advocate, don't you?
Yeah.
So I suppose the question is, how can we, and this is a rhetorical question, how can we as collective stakeholders in this profession elicit that buy-in, that investment, and get employers, a professional body, universities to these events,
Exactly that. So moving forward, we will be working closely with organisations I previously mentioned, and doing these events so that they get a chance. They're going to have stands there, governing bodies, central government organisations, as well as local government organisations. So young people will be able to interact with these people and actually really get an idea of what it's like. And sadly, look, one thing I've noticed is there hasn't been much of a change in terms of demographics of the profession. It's not reflective of society as a whole.
No.
Right? And other organisations have made huge strides in that area. Like, just if you look 15 years ago, 20 years ago, the police force, for example, was predominantly white male. Now look at the police force. They represent the communities that they serve. Environmental health is lagging behind here. And not only that, there's a huge group of people that haven't been tapped into. A huge group of people that would be interested if they knew what the role entails. And would be best served to work with these communities, because potentially second languages, living amongst these communities. So, I feel that you know, you can't be what you can't see, right?
Yeah.
And young people, if they're not seeing environmental health professionals that look like them, they kind of almost like, well, it's not really a career for us,
Yeah.
which is the same issue that the police force had,
Yes.
but they've eradicated
Yeah.
that by
Yeah.
being at events, by doing community engagement events, and by interacting, and it's completely changed.
Yeah. No, I think you're right. We need more representation. And you see it in press releases. So the Guardian might run an article on rogue landlords or criminal landlords. Where's the environmental health voice? Where's the voice of the regulator?
That's
You know,
right.
in Grenfell and Awab Ishak case, there was people from the Chartered Institute of Housing, the landlord associations,
But where's the voice of the
the
environmental
Ministry of
health?
Health
Yeah.
and local government. But yeah, where's the voice? So I think our voice is missing. Normally, people will not know about environmental health until they ask for service. So what I was going to say, the reason I mentioned my age was my brother's a bit older than me. I met one of his friends. He's like mid-50s. He lives in a house, and he was talking to me the other day about his damp. And I said, well, you know, he lives in an area with a big city. I said, well, why don't you ask environmental health to come out? And he did not know what we did. So normally people only know if they suffer from food poisoning, there's a noise complaint, their house is damp, or you know they have an accident at work. So it's normally people know
Just
about a service
awareness
when
isn't
they
there.
present in
Yeah.
crisis.
Yeah.
So maybe there needs to be more representation and advocacy. But well, yeah, I don't know how you do that, but we've
But
come up
also,
with some
well, I
ideas.
mentioned earlier, so the world that young people hang out is a virtual world,
Yes,
right?
yes,
And that's very different from when we grew up.
yeah, yeah,
You'd pick up newspapers, you'd pick up magazines. The internet was barely starting, right? So you'd get to know about things by speaking to people,
yes,
reading about it, picking up an encyclopedia, right?
yeah,
Now everything's at your fingertips.
yes.
And I feel environmental health as a profession hasn't kept up with that.
No, and if you look at some populist politicians in this country and other countries, some commentators say credit them with doing exceptionally well at promoting their message. We may not agree with their message or their ethics, but some commentators say that some of these more populist politicians have done exceptionally well at mobilizing interest, following, messaging by using or misusing social media. So maybe there's a role for environmental health representation advocacy.
I firmly believe there is.
To use social
I firmly
media.
believe there is, and it's about collaborations as well.
Yes.
You know, so if two organisations collaborate, both their respective followers get to see,
Yes.
engage, and interact.
Absolutely. Yeah. Great stuff.
Right. Gone a bit off topic, but it's been very interesting.
It's all natural and organic.
So where do you okay? So where do you think the biggest areas of transformation are within environmental health? Would it be environmental protection, housing, food, public health, health and safety?
So I think the number one pressing issue is to solve this workforce crisis. I think unless we have a workforce that can deliver some of these excellent services, we're not going to be achieving our prevention potential. So I think where the most transformation needs to be in is, as we've talked about, advocacy and representation, but also investment in the profession. So where are we going to get that from? So from politicians, from MPs, from leaders of organisations like health and social care, health and wellbeing boards, directors of social services, housing departments, NHS leaders, leaders of health and social care, leaders of public health, leaders of Chartered Institute of Housing, EHOs. So I think we need to transform our workforce and be influential. And we're going to do that, by, as I said earlier, by developing personal relationships. I went to a conference in London, and it was about housing. So I'm into housing. Housing's my background.
Yeah.
And there was a representative, a director of the Chartered Institute of Housing, and someone asked her a question. And she said, well, the thing is, I was talking to this MP the other day, and I was talking to the head of this chair and this parliamentary committee. That's where we need to be. We need to have higher level representation.
You need to have representation
Yes.
and a voice, but also you because environmental health has that unique opportunity to kind of be the in between.
Yes.
Because very hands on, know what's really happening.
Yes.
But and have that voice to actually influence.
Yes.
Influence,
Yeah.
legislation.
Yeah. One thing I would ask, during the transformation, where can we transform, is to ask employers where they can appreciate they've got very little resource. But we have some students who graduate without much practical experience, and then they're finding it hard to get jobs because they don't have the practical experience. And we talk about recruitment. So one thing employers can do is to offer placements and training opportunities for students. So I think local authorities can. Some do. Some are really progressive. Some take on apprentices. They send people on our courses and other courses. But there's some local authorities who just want to kind of employ trained up, shovel ready EHOs, which may or may not exist. But yeah, I think another area we can transform is by every environmental health employer providing some sort of
shadowing.
Doesn't have to be a 6-month internship. It can be a day shadowing or a week's shadowing. So I think that's another part of this workforce
here at
strategy.
Buckingham Futures actually. Graduates that have practical experience get snapped up.
Yes.
Those that don't take very long. And what I always recommend, or in fact we arrange, is for them to shadow one of our officers with the local authority's permission, for a day a week, as you propose, for a 3-month period, and sort of rotate around.
Yeah. And it tends to be, we're talking about vulnerable communities, disenfranchised communities, minority communities. It tends to be international students or global majority students who don't have a relationship with employer, who are one, least likely to get practical experience, and therefore most likely not to get a job. So we did a survey and the results are quite, I won't say shocking. Let's say shocking for the podcast. The results are shocking and a concern for me to do something about it. So 37 home students, 27 of them found employment after graduation. I think it was about 20 international students, 17 of them hadn't found employment into.
That is shocking.
And one of the reasons they're being told, some of the barriers are no UK driving licence. So there's things employers can do to not make that a day one requirement. And the other big barrier we find is practical experience. So again, there are local authorities, got credit where credit's due, who take on grads with no experience, employ apprentices, train, mentor, do all those things. But there's some that don't. So that's a kind of area of
sometimes it's quite stretched, and it will slow the already, and I do understand that.
Yes,
it's a bit of a catch-22.
Yeah,
because you've got some local authorities have had up to 80% cuts, so they're really stretched right now.
Yes,
and for them to then take on someone to shadow is going to slow them down, because you can't do an inspection at normal speed and carry because you have to explain it to someone. So I do understand why that is, but if they're not investing into the next generation, how is the next generation going to come through?
It's understandable. We understand the rationale, but unless there is an investment, be it from the employer, be it from the universities, be it from the CIEH, unless there's an investment to offer placements and practical experience, we won't have a workforce.
No, because we've got some exciting projects coming up, which I'm not really allowed to discuss at the moment. But we're working with a group of local authorities, 10 of them, where we're actually going to employ someone to shadow students to shadow them, and they'll be employed across 10 local authorities. But their sole role would be to undertake work and there'll be food specialists.
Yes,
there'll be housing as well as environmental protection, and they will all that will be their role for a 12-month period, and that will solely be their role.
You can import this model to Bristol. We're trying to work with local employers, and they are giving us the odd day here and there. The other thing to say about our student survey or graduate survey is where these graduates are going. So you talked about some international students who get a degree in the UK and then go back to their own home country, get a job. We have about 50% of our international students do that. About the other 50% want to stay here and get a job. So they're telling us about these barriers they're facing. What really saddens me is it pops up on LinkedIn. I've suddenly got a job in hospitality. I've suddenly got a job as a care home manager. I'm now a healthcare assistant. So these are very laudable, fulfilling jobs, and they're getting jobs in health and social care. They're getting jobs in NHS. But there are these barriers.
They're not utilising their qualifications, or they're not being able to.
Yes, and I would argue that there are some employers, not all, who are putting barriers in place, such as you've got to have practical experience, or we're not going to take on a grad without experience, or you don't have a UK driving licence, it's a day one requirement. Really? Why not make it a 6-month requirement or part of the probation? Why not? Yes, I hear what you're saying, it slows you down, but unless we invest in the future. So we were talking earlier about what can we do to get more people in the profession. give them a chance. Some of these people who've got a master's or a bachelor's degree are incredibly hardworking. They're doing it whilst juggling family, friends, relationships, children, caring
Change of country as
responsibilities.
well.
Yeah, change of country. And then they get a job and they get, oh, you got to get EHO registration, got to get a driving licence, got to get a deposit down to rent somewhere, graduate visa. So all I'd say is
It's a lot of barriers.
we as a profession can reduce those barriers by doing a range of things. But it saddens me that so many of our international students aren't getting jobs in the environmental health force and workforce. And on the other hand, we hear employers saying, we can't recruit for love of money. We need a shovel-ready EHO and we can't get any. Well, you know, I am biased, clearly. I would say take on a grad with no experience and train them up. Easy for me to say.
Commitment,
yes.
And you know they'll be quite useful quite quickly
Yeah.
because they'll have the academic knowledge.
Yes.
They just need to put it into
Yeah.
practice.
And in 2-3 years' time, they might be a manager, they might be a leader, they might get promoted.
Yeah.
So, yeah.
Do you think student attitudes have changed at all?
So, interesting question. So, over the last 4 or 5 years, I think I've certainly seen a change in all students, the way students approach university. So, I must disclaimer, I'm just as guilty as doing all these things when I was a student 30 odd years ago. So we see the what we call the professional student or the strategic student. So some students will strategize their engagement and their attendance and focus on the assessment. So they hit the target but miss the point. They can struggle to get jobs because they haven't immersed themselves in the learning experience. Okay, you know, we've all maybe done that. So we see students be more strategic about what they engage with and what lessons they come to, and much more focused on the assessment. So that's a shame, particularly if you're a lecturer and you've invested all this time in a lesson plan. The other thing we see is the jump. So every student must make this jump to develop their decision making and judgment skills. They have to develop critical thinking skills that become an analysis, evaluation, reflection, criticality. That's a jump. Not everyone can do that in 3 to 6 months. Everyone can do it, but it takes some people longer.
People develop at different
Yes.
stages.
Now, I'm biased again. I've got my own views on our Victorian-based education system that promotes like this rote learning and just repeating stuff back. So I think some students have this assessment anxiety, and I think that's formed from conditioning. So we see more students be strategic and anxious about the assessment, and I think some of that is the conditioning they have from the education system. The students that are self-managing, self-learning, go off and do the reading, read around subjects and really proactive and hungry, they're the ones that get the job. So we do see more students, not just environmental health students, but more students in general being much more strategic about how they engage. Now, some of these people have, as I say, families, they're carers, you know, they're married, they're children, they got maybe other jobs. They can't afford to spend a weekend reading a book. But that's so important. I would say that's what we've seen. The other thing we've seen is our student demographic. So when I first started, we might have some mature students, you know, people are 30 or 40, mid-career changes. We're now seeing a lot more students in their 50s come and join us, a lot more from the catering industry. We're seeing more international...
Well, your masters or for the degree?
On our masters, yeah. We're seeing much more international students, particularly from Africa and Asia. That's slowed down. The last government introduced what some people say more hostile barriers to entry, but with no dependence, can't bring dependence over, and the cost of these visas in other economies has gone up. So we're seeing a slight drop off international students, not just at UE but all around the sector. And the other thing we're seeing is we've got a lot more students from Wales. So the Welsh authorities there isn't a masters in Wales, and they can't access the apprenticeship levy. So and also Wales, they seem to be a lot, because they're smaller, they're more organised, they talk to each other, they can meet. Maybe it's because they can meet.
Cardiff not offer their masters?
They're paying for a lot of their students to come do the masters at UE.
Okay.
So currently we've got 7, 8 or 9 part-time students, and more coming from Wales, who are propping up our course, and you know, we're very grateful because they're investing in the workforce, and they're taking these people on, and of course these people can go and get another job somewhere else.
Going back to what you said before, right? I thought you were trying to get my attention.
Sorry, I got fly.
Yeah, no, like, is it time's up?
Yeah, I
or
thought you
something?
think you're taking too long.
Sorry.
Stop counting.
Right, cut that bit out, obviously.
Yeah.
No, I thought you like trying to say like cut
I
it
thought
off.
you were saying
Yeah.
something. Yeah.
Ellis, so going back to what you said previously
Yes.
about practical experience.
Yes.
and that sometimes it's not always practical for the student to get experience. So, is there things that lecturers or universities can do to try and embed real life teachings into lectures?
So this is something we really do. So when I went to university 30 something years ago, we sat in serried ranks, we listened to the lecture, we took notes. That's the way it was. You got on with it. It's now acknowledged that doesn't work for everyone, and that type of teaching style, didactic lectures, maybe 10% of the people take 10% of it. We now know about neurodiversity and people process information differently. Some people are kinesthetic learners or learning by doing. So yes, of course. So we have activity days and we have simulations. So we're very lucky at you. We've got a courtroom, we've got a crime scene house,
Oh, wow.
We've got a post office, we've got rooms, we've got bed sits, we've got
You never
kitchens.
showed me any of this when I
Well,
visited.
when you come next time, I promise to show you. We've got all sorts of spaces. We've got, virtual reality, and we've got a whole range of stuff. So what we do is we simulate activities, and the idea is it's a safe space to learn, make decisions, make judgment. So it's a safe place for students to learn, to make mistakes, and we're doing role play. But that is not, although that's useful, it's
not the same as
it's
being
not
a-
a substitute
yeah.
for going out placement. So if you're a teacher, a policeman, a nurse, a pilot, a surgeon, you will do probation, and you will go out, and midwife and optometry. You said earlier you worked, in optometry.
Or the dispenser.
Dispenser. You would have had some practical experience. So you can't be an optometrist or a midwife without any practical experience. But environmental health, somehow we have a degree program where you can graduate without one day's practical experience, and then we wonder why some of these graduates haven't got jobs. So yes, we do build in these graduate skills. We do build in simulations. So we inspect kitchens, we inspect houses, we investigate accidents in a pretend post office with a mannequin kind of lying on the floor with a ladder, and we all play different roles, and we do things with public health, infectious disease control. We have practical experience days, we have activity days, and we have case studies, and we can do that all we want, but it's no substitute for
the
watching
real-
someone
do
do
it
the
in
job,
real life,
because it's
yeah.
got a bit more contextual knowledge. The other thing about those for our students is our graduate outcomes. So, skills we teach. So we've become like auditors and regulators. That is a very important part of the job. But we need to teach more entrepreneurial skills. So for any scholars or academics out there, something called Bartram's Great 8. If you Google Bartram's Great 8, it's actually 8 pairs of skills like presenting, negotiating, executive.
I wouldn't read up on that.
Okay, yeah. If any graduate of any bachelor's program or postgraduate program, if any university develops these skills, it will equip that graduate into the workplace. And it's no different for environmental health practitioners. So it's things about negotiating, presenting, executive decision making, cooperating, compromising. I can't remember them all. There's 16 of them.
I'll look it up.
There's 16 of them, but it's called Bartram's Great 8, and it's 8 pairs of soft skills. So as well as the simulation activities,
Something I'm going to speak to my children about as well.
yeah. So we try and teach them those entrepreneurial soft interpersonal skills as well as the decision making and the judgment in the simulation
Excellent.
spaces. So we try, but it's no substitute for the real life.
Okay, this is a bit of a random question, but if
Yeah.
you could completely wipe the slate clean
Yes.
and start with, so environmental health is a profession that doesn't have any misconceptions,
Yeah.
and you could start now, right?
Okay.
What would be your top 3 priorities?
So I think a national workforce strategy. So if you look at public health consultants or teachers or policemen, nurses, they have a workforce strategy. The government sits down and works out how many nurses and doctors and dentists we need. So to be part of a national workforce strategy that's invested in, to have placement experience, to have continuous professional development. So some regions do their own CPD, their own training days. Some don't. Some regions don't have any face-to-face events. So if you're a newly qualified officer, get back into the real world. So the question was, what top 3 priorities?
Yeah, so it was
Yes.
it was up to Ellis.
Okay.
It's,
Ellis's world. I think I'd just embed a vocational training program. So there's some really good professions: paramedics, midwives, optometrists. I talk about these other allied health professionals or vocational health professionals. They have practical experience, they have placements. So have some placement activity. So all those progressive employers who are putting people onto the apprenticeship program, great, chapeau, round of applause. They're investing in their profession. But we need every local authority and every university and every part of our professional bodies, healthcare, social care, NHS, to be part of this workforce strategy. So yes, we've now got people joining the profession. We need to train them up with a really good placement vocational training, and then once they've graduated, they need to have a supported framework of continuous professional development. At the moment, it's ad hoc, it's regional, it might exist, it might not. We just need a national framework. We need a national workforce strategy, and we need investment. And we're not going to get investment by talking around and saying we don't have any resources. We just do our statutory duty. We shouldn't take risks or innovate. Or we mustn't have compromising headlines in the newspapers. Stop being ruled by fear. Speak truth to power. So I went off on a bit of a rant then.
Very, very valid. When you mentioned we've spoken quite a lot about attraction.
Yes.
But also retention once people have graduated. Yes. Sometimes they find themselves in environmental health roles, but quite often move discipline completely after. So what do you think can be done about retention?
Yes, I think you're right. No one can be expected to stay in the same job for 5 years doing the same thing, but it's reasonable expectation that someone might stay in the same organisation. So environmental health practice is really poorly researched and really poorly evidenced and really poorly published. So perhaps we develop research skills in our practitioners. That's something we could do. The problem with local government is it's a very narrow, flat kind of triangular structure. So, there might be 5 officers to every manager and then 5 managers to every senior director. So there aren't many opportunities to go up. But there's other kind of partnerships of prevention work we could be doing. So I think give people. So
the career pathway, it's visible, but it's just not accessible.
There's not many opportunities. I don't think local government are often the most progressive employers in terms of developing. Some are, so I'm not surprised people go elsewhere, and we get people going to public health, get people going to health and social care, get people going to the private sector, and into consultancy. So I think if we want people to stay in the profession, we have to give them new, exciting, progressive opportunities like research, policy making, like partnerships for prevention. So we're good at regulation, we're good at auditing, but maybe we need to think beyond regulation and think more about how we can get stuck into health and wellbeing board strategies or get stuck into public health policies. Because as you said, EHPs are we're the glue or the mortar in all the brickwork.
Holds this all
together. So I think, need to think a bit innovatively and originally how we can create opportunities for environmental health practitioners within environmental health. So you see some people go and work for the it used to be DLUC, I think it's called the Ministry of Housing and Local Government now. So, maybe have a pathway of people going to public health, pathway of people going into central government, the civil service. Maybe have a pathway of people going into all parliamentary.
Have options,
yes,
different options.
Some into research. But currently, there's no real formal structure.
No, there isn't.
And people make their own
opportunities. People fall into different things, almost fall into it, don't they?
Yes, absolutely, yeah.
And if they do carve a career, it's usually of their own doing.
Yes, absolutely, yeah. Yeah, no, it's often the most highly motivated, hungry people who go off and do consultancy.
Talking of hungry and motivated, what are the main attributes? So, not just for graduates, say someone's looking to go into the profession.
Yes.
What would make a successful environmental health professional? What are the attributes?
Well, probably defer to the Berkshires' great aid. So soft skills. So everyone can learn technical knowledge. They can learn theory. They can learn construction, anatomy, physiology, food science, microbiology. So you can learn theoretical subjects, but ultimately you are an interface. So an environmental health practitioner has to be a surveyor and an inspector. They have to be a communicator, sometimes a social worker, sometimes a conflict resolver, sometimes a conflict de-escalator, sometimes a mediator. Then they have to gather evidence, then they have to give evidence. So they're a regulator, they're an enforcer, and sometimes they're managers. So all these things require soft personal skills. So being able to communicate, being able to be kind, being able to compassionate, being able to listen, being able to empower people, being able to enable people. So these soft skills, some people argue you're born with them, they're innate skills. Some people argue
They can be learned.
they can be learned. Yeah. So we need to give.
I believe they can be learned.
No, I think I agree with you. It can be learned. So we think we need to give people the opportunity to practice them. We need to give people the opportunity to make mistakes and not do those things whilst trying to learn to do those things. And we need to give people the opportunity to get into these roles and to have a safe space to learn and to reflect. So at universities now, a lot of learning is about reflection. So I did this, it made me feel like that. I didn't get that right, I could have done that better. Next time I'm going to do this. In the future, I'm going to take this learning, my learning action plan. That's called a reflective cycle. And we can embed critical reflection into our practice. If you look at teachers, social workers, academics, some of this reflective practice is very common, and I think we can do more than that. So the question is, how do we teach graduates these soft skills? But I would argue they're the skills of an EHP that you need.
Fantastic. But so in terms of, we've spoken quite a lot about legislation. Is there anything you would change if you could?
So my bag's housing, so I would start afresh with no legislation for housing and can try and consolidate stuff into one primary act. So what's happened with housing, and I can't talk about other disciplines, is we've got lots of different fragmented legislation. It's kind of poorly understood, it's not particularly well drafted. Some of it conflicts with each other. There's overlapping standards, there's duplication standards, there's some gaps. We've got risk assessment standards or risk assessment approaches, and we've got fixed prescribed standards. So if you wanted to know what fire alarm you need for a certain property, you need to do risk assessment, look at good guidance. It's all a bit fragmented. So if it were housing, I would I would consolidate legislation, and possibly, I don't know this to be accurate, but possibly it might be the same for the other disciplines. The problem with housing legislation is it's poorly understood by landlords and tenants, and you need to get this EHP expert to read the legislation, understand the legislation, interpret the legislation, apply it and enforce it. And that's another set of the graduate skills EHPs need. They need to read, learn, understand, apply, enforce, and then reflect legislation. So consolidation of fragmented legislation that is unhelpful to everyone.
Excellent. Well, the workforce is changing across all sectors.
Yeah.
There's lots of innovation with the advent of AI.
Yes.
There's been lots of changes. Do you think environmental health as a profession has adapted, and if so, what do you think is the most exciting things in terms of innovative changes in the foreseeable sort of next 5 or so years?
So I think, technology has a place to make our lives easier. So inspection technology, inspection apps, being able to look at data, predictive analytics, to find the private rented sector, to find where HMOs are. From an inspector surveyor's point of view, there should be some sort of, handheld devices to help you carry out inspections. For noise complaints, you've got the noise app. AI is a funny one because it's got its time and a place, but you do need to sense check everything. So I think, I know that there's workshops and conferences about AI. I think technology can still make our life easier, but we should never really contract out that thinking.
No, you can't be fully relied on.
No. I mean, I'm not saying
you can't take the humanity away from.
No, I'm not saying it's all going to be Skynet and Terminator, doomsday scenario. But if you don't use it, one fear I have is that I might create a lesson plan using AI, and I have, which I've adapted. So I might create a lesson for a group of students using AI and set a quiz. Just get AI to write it. We give it to a group of students, and they look at it and they upload it into AI, and they then answer with AI. And in the end, you've got these two entities, electronic, remote, not any conscious cognitive action going on, talking to each other, but the teacher and the student aren't actually learning anything. So I just think it
has a place.
It has a place
if used wisely.
Yes, but we were talking earlier about devices and children and what level of exposure and content they should or shouldn't have. So I just think with safeguards, with moderation, with supervision, I think technology it can really transform our work I just think we just mustn't lose our cognitive,
No.
conscious oversight of what we're doing and
No.
how we're communicating. But I have colleagues who work in local authorities who now receive complaints that's been written by AI. It's a bit robotic, it's flowery, they don't know what the person's saying, they have to unpick it. We get work from some students, not just environmental health students, who've used AI. You can't really
Is
prove
it quite
it.
apparent?
Yeah, I mean, it's pretty obvious if someone's used it. The problem, like in any enforcer, is proving it.
Yeah, as a lecturer, that must be really difficult because in our days of being
Yes.
students, early 90s,
Yes.
we were just, I mean, I don't know about your university,
Yes.
but I used to handwrite assignments.
Absolutely, yeah, no, it's the same. And if you plagiarised, which I may have done in the past, you'd still write it out, but you'd write it out differently. Now get software that does that. So as a lecturer, it falls into that category. I talked about groups
And have
of
you
students.
noticed, maybe, for example, there's a student who's writing is of a certain style and they're performing work of a certain standard,
Yes.
and then the standard's gone up, or
Yeah,
they're
I mean,
writing the style of writing.
The problem with using AI, particularly in the field of environmental health, is it's quite specialist and it requires a lot of contextual knowledge. Currently, these large language models don't have that contextual knowledge or lived experience. So it's quite obvious if people are using it. The universities are moving away from written tests and essays. We're using more vivas, more authentic assessments, things like multiple choice questions that can't really you frame where it challenges your verbal reasoning, critical thinking. So it is obvious if people are using it. It's just disheartening because I talked earlier about some students, not just environmental students, who have been strategic.
Yeah.
We want them to immerse themselves in the learning experience. If we're using AI to write a lesson or a reflective journal or to do some research, then you're not learning. So again, it's that kind of, you're hitting the target, but you're missing the point. So as a lecturer, it saddens us that people aren't immersing themselves into this rich learning environment and not having that learning experience. But this is what students, not just environmental health students, are now doing. Some of them, they are just focusing on the assessment. And they're the ones who sometimes might struggle to get jobs afterwards. So yeah, people are using AI, but there's a role for it. It just it's like any new innovation. It's got a time and a place. Like YouTube, as we were talking about earlier.
Yeah, absolutely.
Yeah.
YouTube is a visual
Yes.
platform, but as I mentioned to you earlier, I usually listen to it. It's on in the background.
Yes.
I find it quite encouraging.
Yeah.
I listen to audiobooks, but I won't sit there and watch even podcasts.
No. Yes.
I dare say a lot of people will be listening to this as opposed to watching it.
Yes. Yes.
But look, you've been in environmental health for a very long time. And is there a message you'd like to share with people who have recently graduated and just feeling a bit disheartened or not sure what the next step is?
Yes.
Is there anything that you earlier, like a piece of advice that maybe you were given earlier that still guides you today that you'd be happy to share with our viewers?
Yeah, I mean, the main thing is don't give up. Knock on doors, write letters, talking in really old language now, write emails. But, if you're struggling to connect on network or find employment, then it's easy to ignore an email.
Yeah.
Pick up the phone, turn up at offices, make a nuisance
Great
of yourself, get out into that real world. And messages I'd give to employers, as well as taking on graduates and give them placements, is, it's easy for me to say, but speak truth to power. Innovate, take risks, and work beyond regulation. Seek. Here we go. It's a good one. Which isn't my phrase, but just do. So if in doubt, do something and seek forgiveness afterwards. Don't ask for permission. And local government can be a bit hierarchical. And it's easy for me to say, working in a liberal kind of university where we're encouraged to.
You've worked in a local authority before, so you're speaking
Yes.
from experience.
Yes, I mean, one role I had was with the NHS and public health, and that was where I was given permission to work beyond regulation, to work beyond legislation, and to develop partnerships, to develop personal working relationships and work in prevention. And that work was quite innovative because we were kind of doing different things, but we're finding commonalities with goals. But I was given permission to work beyond boundaries, beyond organisational boundaries. But what I'd say to people is if in doubt, it sounds a bit subversive, but just do something and be bold and seek forgiveness
Be
for
bold and
doing
be
it
brave,
after.
yeah.
Yeah, rather than ask for permission. If you ask for permission to do something, invariably someone will say no, you can't do that. You're not allowed. Well, just do it, and 9 times out of 10 it will go all right. And whilst you might be criticised for not asking for permission, you'll be credited with making a bold change. That's what I'd say to people. Just take
Love
risks
it.
and
Amazing
don't be
advice.
ruled by fear.
No.
And for leaders and managers out there, speak truth to power. And as a manager, I didn't do this. I was a coward. I did what I was told. I followed the party line.
That's very. I appreciate you being so candid.
Well, I was a bit of a coward. I was part of an organisation that there was some kind of micromanaging, some might say bullying went on, and I didn't speak truth to power. Eventually did, but I'd say to any manager or leader out there, take risks, innovate, don't allow people to make mistakes, and yeah, just what was I going to say with regards to taking risks, just do something and just innovate. Yeah, don't be ruled by fear. It's easy to. There's always a reason not. This is what I was going to say. There's always a reason not to do something. So if you're ruled by fear, then you won't be able to progress. But if you just take a risk, and this
That goes
is
with anything in
yes,
life, really,
exactly,
doesn't
yeah.
it? I've even
Yes.
like, I'm taking
Yes.
taking a lot away from this.
well, this is
Because sometimes
yeah.
I feel like, what will people think? Even now,
Yes.
I think, oh, is it the right? But you know what?
Well, I think
I can't be ruled by fear,
no,
can I?
no. In my 40s, I had a convergence of challenges, let's say mental health challenges, and kind of things I hadn't managed very well, and I sought some therapy, talking therapy, saw a psychotherapist, and that's when I kind of reflected is that a lot of my decisions were ruled by fear. So I've been in this kind of fearful, I won't do, I'll be subservient.
You're coming
I'll
from
do
a
what I'm
place of
told.
experience, and I
Yes.
appreciate that. And I
Yes.
appreciate actually you being so candid.
Yes. Well, it's
lot.
probably
I've
probably
appreciated
answering
that a
your
lot.
question about advice
Yeah.
you can give. So it's easy to be ruled by fear. It's easy to not do something. So just do it anyway. Don't ask for permission. Just do it. Seek
Just do it
forgiveness.
like Nike.
Yeah. And yes, you might get some earache, but you've done what you've achieved your goal. You've done what you've wanted to do, and you've got it out there. Now the only problem is, if everyone did this in the world, it would be chaos and anarchy. But not everyone does it. So I think that's a very long-winded bit of advice to.
No, I appreciate that, and I
to
think our
be
viewers will
bold.
too. Well, I know they will.
Yes.
Just to wrap up, what excites you most about the future of environmental
Okay.
health?
So the profession has this immense potential to prevent ill health, to reduce accidents, to reduce infections, to ensure psychological and physiological requirements are met, to reduce poverty, to reduce deprivation, to enrich people's lives, to add years to life and life to years. We have this immense
Add
opportunity.
years to life and
Yes.
life to years.
We can do that. We can
I
do
like
it.
that.
But
Did you just make it up now?
No, it's from Marmot Review.
Okay.
And
Add years to life
yes.
and life to years.
Well, some people say that if you extend someone's life, you're just adding years to life, and it can be quite unfulfilling. But the best thing you can do is add life to
Life
years.
to the
So
years,
that was
yeah.
where it comes from, kind of end of life care. But we can, as a profession, we can make people live longer and
Live
more,
healthier for
live
longer.
more fulfilling lives. So we have this great
Fantastic.
potential to do that, and we can do that by investing in the profession and preventing ill health by doing what we do best. By regulation and through partnerships, for engagement, through education, through empowering and enabling communities. So that's our potential, and I just think we are not yielding that full potential for lots of reasons, and some of the ones we've covered in this podcast. So what excites me is the potential good we could do for the
Fantastic.
world, and
Your excitement is oozing up.
Oh, thank you.
I'm feeling very excited.
Great stuff.
Maybe I should change professions.
Yeah.
In fact, you know what?
Come and do the masters at
I
Uri.
was going to do the masters.
Yes. Okay. Yes.
I think
Yes.
I briefly told you,
Yes,
didn't I?
yes.
I ended up doing the masters in environmental planning and management,
Okay.
as opposed to the environmental health masters.
Yes.
Reasoning was probably silly, but it was at the time I didn't have a car, and Middlesex University was the
Yes.
nearest one offering it. Was
Okay.
in Trent Park. It was very difficult
Right.
to get
Okay.
to by
Yes.
public transport.
Yes.
So I ended
Gosh.
up doing a masters in
Yes.
environmental planning
Okay.
and management
Yeah.
instead.
Right. Well, you're still part of the profession.
Yeah.
And a stakeholder. So no, thank you.
Thank you for joining us on the Buckingham Blueprint podcast, Diary of an EHO. To follow us across all platforms, please follow us on Buckingham Blueprint. Thank you.